pint can save three lives. A single gesture can bring a million smiles. A very good morning to one and all. Hope you're all doing well. On behalf of YRCVIT, I, Gauri Mathur, welcome you all to our event. So, before getting started with today's event, I would like to say a few words about the club. The Youth Red Cross Association is one of the most notable clubs of VIT Vellore, with the motto of service before self. From organizing blood donation camps to performing skits on social issues to our campaign against social abuse, CASA, we have upheld our motto every time throughout these years. Even in this pandemic situation, we have been actively conducting several events online to spread awareness of various social issues and work towards the welfare of society as a whole. It is said that every 2 seconds every day someone needs blood. Blood is an essential building block of human life. Today, millions of people around the world rely on donated blood to stay alive. But the amount of blood donated every year falls far short of what is actually needed. India falls short of its actual annual need of 12 million units a year by 3 million units, according to a World Health Organization report. With more than 1,200 road crashes occurring every day in India, 60 million trauma induced surgeries are performed in the country every year. The 230 million major operations, 331 cancer related procedures like chemotherapy, and 10 million pregnancy complications all require a blood transfusion. Besides this, patients being treated for sickle cell anemia, thalassemia, and hemophilia require large quantities of blood daily. Blood safety poses a major challenge in this scenario. Even though blood transfusion is considered a safe process, it may pose high risk for the recipient if the blood quality is not ensured. Using contaminated blood in transfusions may cause different bloodborne infections or allergic reactions. Hence, blood screening is an essential aspect of the transfusion process. Voluntary blood donations increased from just 54.3% in 2006 to 83% at the end of 2012. Credit for this can be attributed to many NGOs and blood bank organizations that have been working and operating in India, trying to sensitize the public of the benefits of blood donation. One such organization is the Blood Connect Foundation. Blood Connect is India's largest youth led organization working towards making India blood sufficient. Our mission, started by young IITians from Delhi, the organization aims at elevating the problem of blood shortage in India by raising awareness and improving donor experience. To enlighten us further on the topic of blood safety today, we have with us Mr. Deepak Goel, Chairman, and Dr. Suman Chintala, the Director of Blood Connect Foundation. Dr. Suman Chintala is currently working as an assistant professor in Water and Environment Division, Department of Civil Engineering at National Institute of Technology, Warangal. Mr. Deepak Goyal is working in the position of Global Portfolio and Strategy Lead and Director India at Shell Foundation. Without any further ado, I would like to hand it over to our speakers.
Thank you, Gauri, and thank you, Youth Red Cross, for inviting us and giving opportunity to speak about blood donor safety today as a part of your safety week. I hope I'm audible, right, Gauri?
Yes, sir, you're audible.
Thank you. And thanks, everyone. And Gauri, thanks a lot for setting up the stage very well by giving the background on why blood donation is so important, right? And as a part of blood donation, the blood donor and patient safety is actually very, very critical, right? Whenever we speak about that. So today, along with my colleague, Dr. Suman, we'll speak about donor safety. We'll speak about some of the myths around blood donation from the perspective of donor safety. And then we will also speak about in brief what happens to the blood you donate after the blood donation, right? and we will try to basically tell you about stuff in pre-donation, what to be careful about before donating blood, during donating blood, and after donating blood from the safety perspective, right? Gauri has very well explained why to donate blood, so I will not go into that. And she has given a great introduction to Blood Connect, which is a voluntary organization run over the last 11 years by youth of this country, by people like you. And we have managed to conduct almost 1,300 camps, blood donation camps in 11 years, collecting more than 125,000 blood units. Um, and through efforts of people like you, we have managed to reach more than 10 million people across India, telling them about blood donation and why it is required, right? Not to mention that blood donation or having us access to a safe blood is a fundamental thing to any healthcare infrastructure in any country. No healthcare can serve to the citizens without access to safe blood. And for access to safe blood, blood donors' safety is of utmost importance. And this is one area which is on the mind of every donor, including myself. I have donated blood more than 30 times. In fact, I've stopped counting. I'm working in this area for 18 years, from 2003 when I joined IT Delhi. And I myself looked at more than 50 camps, right? So I can tell you without doubt that one of the most common questions that we get from all the first time donors or repeat donors is it safe to donate blood? What do we do to make sure that we don't get any reactions after blood donation? This is one of the most common questions. The second one that comes is, does it help us? It helps patient, but does it help us? Why should we donate blood in addition to just saving someone's life? Right? So let me take the first question first. Is it safe to donate blood? Yes. Every year, more than 120 million units, blood units, are collected across the globe, which means 12 crore units of blood are collected across the globe every year. And based on all the data that is being collected globally, blood donation is absolutely safe, subject to healthy blood donor and subject to safe process of blood transfusion done safely at blood donation camp or hospital. So I have said two big conditions, subject to healthy blood donor, right? So let's talk about that first, right? For every blood donor, if you're going to donate blood, number one, the key thing is the donor must be fit and healthy, and he or she must be feeling fit and healthy, right? That feel that I am doing good today is very, very important. Your body should be with you, your mind and heart should be with you when you're going to donate blood. You might be feeling like anxious, you might be feeling fear of needle. That does not make you unhealthy. Right? That's an anxiety of like doing something first time. That's not about unhealthy. But if you think you have a pain in the body, if you think you didn't sleep well, if you think you're not feeling well genuinely, right, please don't donate blood. So, number one rule is, as a donor, I must feel healthy. I must feel healthy. Number two, I must be healthy. Feeling healthy, and now I must be healthy, right? Second. So let's come to the point. Feeling healthy is something in your mind. So I can't explain you more about that. The second point is to make sure that you are healthy and you are eligible to donate blood. How do we ensure that? What are the basic criteria for that? Right? That you are healthy and you can donate blood. There are few very, very basic things on that, which is around your temperature, which should be within the normal range, right, of 98.6 to 99 degrees Celsius, which is about blood pressure. If your blood pressure is not within a normal range, you might be healthy, but you should not be donating blood. Because what happens after blood donation is your blood pressure fluctuates for a certain small period. And if it is already not in a normal range, it can drop. It can drop significantly. So your blood pressure must be normal, right? On that. Third, hemoglobin, right? Which reflects the tendency of blood to carry oxygen, right? Must be normal. If your hemoglobin is low and you donate blood, the oxygen carrying capacity of the blood drops, which means you will feel tired, which means the chance of you fainting goes up, right? That's the reason why people insist on hemoglobin, right? Now your blood pressure, your hemoglobin, and your temperature, if doctor will not feel right, will be checked on site during blood donation or before blood donation. Please don't rely on these readings taken during your last blood donation. All these things must be checked on site during blood donation. Now, very, very critical stuff. Third thing is weight. There's a requirement to have a minimum weight of 45 kgs, right? Typically, weight will not be checked for everyone. People can see in some cases that you're obviously more than 45 kgs, and where there's a borderline, they will ask or they will check. You might not have a weight measurement in every camp just because people know their weight or they can see that, right, on this. But hemoglobin, blood pressure, and temperature will also be generally through a feel. And only if doctor will feel your temperature is high, they would use thermometer. Are critical and ask for it. It is your right as a blood donor to ask for these things, and it is your right as a blood donor to refuse blood donation if your blood pressure and hemoglobin are not getting checked at blood donation camp, even if it is a blood connect camp. It is your right to refuse blood donation if it is not checked, right? And don't feel shy about it. As I said, it is a right given to you by the government through the guidelines that every donor must go through this. And this will go a long way in ensuring your safety, right? These are the things that will happen on the camp side. There are a few more things that you need to probably keep in mind, right, for your safety and for the patient safety, right? For your safety, the key things are that, as I said, the key element is you must feel good, which and you must be healthy, which means also you must have consumed food within 3 hours of donation. Don't donate empty stomach. Again, you will feel weakness with that and you can faint. Very, very critical. And don't try to show off. Okay, my friend is donating. What if I will tell him I have not had breakfast or lunch? Let me just tell the doctor, no, no, I had a meals and donate. No. Don't try to be smart in saying that you had a meal when you had no meals. Your body will react. You can faint, right? So please make sure that you have consumed food within 3 to 4 hours of blood when you're planning to donate blood. Very, very, very critical. Sleep properly last night is a part of your overall wellness. As I said, you must feel good. This has nothing to do with other things. This is about feeling good, that you're not feeling tired, right? Carry the list of all medicines prescribed to you at that time or within a week. Why I'm saying that? You might not be sure whether you're eligible to donate blood or not. And you might want to check with the doctor that you are taking these medications. Should you donate blood or not? Right? So if you are taking any medications and if you are not sure that you should donate blood or not, carry the prescription so that the team on ground can advise you whether it is safe for you and safe for patient. This part is important for you and for patient to donate blood, right? Very, very important part on this, right? There are a few things you also need to keep in mind around smoking and alcohol, right? Both of these, like alcohol, consuming alcohol 24 hours before donation, can have impact on the patient safety when they get blood. And smoking before the blood donation, just before the blood donation, can actually have an impact on your blood pressure after donation. Right? It has been proven that smoking just before or just after can actually manipulate your blood pressure on this, and that is why doctors advise not to smoke 2 hours before or after the blood donation. Right? Similarly, caffeinated beverages, they can have significant impact on your blood pressure, because remember one thing: when you donate blood, which is 300 to 400 ml, not much, it is less than 10% of your body. While the body will recover that within 1 or 2 days, it does reduce liquid in your body, fluid in your body for some time, right? Which means your blood pressure is expected to fluctuate immediately after blood donation. It is expected. It's not dangerous, but it is expected to fluctuate, which means you must not do anything which will make that even more bad fluctuation, right? So these things are in your hand. Bottom line, if you are in doubt, if you're in doubt, ask for it. Don't assume. Please don't assume it is about your safety, right? Quite a few people ask about tattoos. Quite a few people ask about gap between two donations, about menstruation cycles, right? So let me just tell about that. About tattoos, the recommendation is 6 months. Minimum is 6 months. The guideline changes based on different hospitals. Most of the hospitals prefer for 12 months not to donate blood after having tattoos. Now, a lot of people have asked me why. What is so special about tattoos that you cannot donate blood 12 months after having tattoo? See, the problem is about a potential risk of infection to a patient. When you do a tattoos, most of the time you use needles for making tattoos on your body, right? Now there is a small possibility, not significant, there's small possibility that you might had infection, not dangerous ones, but few some infections in your blood due to those needles used for tattoo, right? And the reason for that is there is no control mechanism, that the needles being used are sterilized, are 100% safe when you go for tattoo, right? There's no control on that because most of the people get tattoos on street, right? And the needles are shared. So as an extra precaution, there's a guideline to avoid blood donation at least for 6 months after tattoo, and generally for 12 months as a guideline, right? So that's the reason for the patient safety, so that no infected blood goes there. For women during menstruation, it is recommended not to donate blood up to 3 days after menstruation, because your body is still recovering and making for the blood loss during menstruation. It is generally safe to donate blood after 5 to 7 days after menstruation. There's no problem. It is safe to donate blood, right? Coming to the second part, before I will hand over to Suman sir, there are two things I want to actually tackle. One is it, are there any medical benefits for donating blood regularly? So we all know about benefits to a patient. As I said, Gauri explained very well why we need it with some facts. So I will not go through why we need to donate blood for patients. I always say that it makes me happy when I donate blood. I feel very, very happy probably after the blood donation. One of my most happiest day, honestly speaking, when I donate blood. But other than that, there are few benefits, medical benefits to regular donors. One of them is it maintains the iron level in your body when you donate blood regularly. Sometimes iron level can go up, but when you donate blood, your body replenish the blood, replaces the blood within few weeks, and that helps maintain iron level in the body. It helps maintain blood pressure in the body when you donate blood regularly. There have been number of studies done, including millions of people as a for surveys in the last 12 years, and no study so far has said that there's no benefit to a donor after donation blood. The studies have said a percentage ranging from 30 to 10 on reducing the risk of dying from certain diseases for those who donate blood regularly. Different studies have put those numbers to 30% to 10%, right? Particularly for cardiovascular disease, right? Now, all these are studies done by based on surveys. So I will not tell you to believe them what I'm saying, but I'm telling you that no study so far has said that there's no benefit to a donor. Our ex-health minister, Mr. Harshvardhan, during COVID, clearly mentioned that in lot of cases, the personal benefit of donating blood regularly actually outweighs the benefit to a patient, right? So let's be very clear: there is no harm. You save someone's life, but also it helps you as long as you follow some basic guidelines on when to donate. It helps you yourself, it helps your body if you donate blood regularly, right? As I said, quite a few questions comes around COVID. Is it safe to donate blood now during COVID? Unfortunately, blood donation during COVID has dropped significantly. In Blood Connect, we have organized more than 225 blood donation camps just last year. And I can tell you from our own experience that in the camps where we used to had 150 to 200 blood donors before COVID, now we are only getting 60 to 80 blood donors, which means there's a shortfall of 60 to 80% in blood donors due to fear of COVID, due to fear of two things. Will I get COVID if I donate blood, either because I'm closer to the people or because of needle? Answer is no. Clear no. COVID virus does not spread through needles. It does not spread at all. So far, there has been no evidence globally, and WHO and others are doing a lot of research. There's no evidence that COVID virus spreads through blood transfusion at all. And in blood donation camps, we take care of basic precautions, which are making sure there is social distancing, and the staff is wearing mask, and we encourage all blood donors also to wear mask in blood donation camps. Again, it's your right. Your safety is in your hand. It's your right to ask for it. If you think people who are managing you or people who are attending you in a camp are not wearing mask or are not following COVID protocols, don't go away from the camp or from donation. If you feel that COVID protocols are not followed, ask for them. Don't make it as a reason not to donate blood. Ask for it. Tell people, please follow COVID protocols. Please make it safe for everyone. And I am willing to donate blood. Right? Ask for it. You will do good for a lot of people by asking for it. Right? As a precaution, it is recommended to donate blood 14 days, only 14 days after you get vaccinated, right? Or 28 days after you've COVID recovered. Again, there has been no study to prove that COVID can spread through transfusion, but this is a precaution because we don't have any evidence, right? This is a precautionary guidelines which are being followed in India to make sure that the risk of any transfusion is negligible, if at all, right? On this transfusion, right? So this is really on the COVID. There are few things around, when you can donate blood, when you cannot. I will not go through details. We have a detailed document on this we can happy to share, like malaria, dengue, typhoid. It is impossible for everyone or for anyone, including myself, to remember all these numbers. There are too many numbers: 3 weeks, 4 weeks, 10 weeks, 12 weeks, 2 months, 8 months, right? And there are like 50 plus such guidelines or 50 plus such things where you can or cannot donate blood. So again, I will repeat, don't worry about these numbers. You are not expected to know this. Ask. Ask people on ground if you have any doubts whether you can donate blood or cannot donate blood. Don't go into nitty-gritties of the numbers, right? For this. The key things are hemoglobin, blood pressure, temperature, and your weight. All other things, don't worry about them. Ask people on ground, right? So I will not bore you by going through these numbers, but I just want to tell you that there are guidelines from Government of India on when you should or should not donate blood, right? So there are guidelines around that. It is not that doctors or Blood Connect will have a discretion. No, there are specific guidelines around it on this, right? Very specifically now during donation, as I said, the key part of during donation is number one, feel healthy. Number two, ask for basic test. If mini physical check. If it is not being done in the camp, ask for it and refuse to donate blood if it is not being done in the camp. Number three, and I think Suman sir will talk more about that. Make sure that the place where you are donating blood, the couch is clean and well ventilated, right? If it is congested, suffocating, refuse to donate blood. You must have space and you must have good flow of air when you're donating blood. You should not be donating blood if you're not able to spread your legs or if you are not able to breathe properly. It's your right to ask for it, right? And Sumansa will tell you more why to do that. Blood donation does not take more than 10 minutes. Actual blood donation. The process around it can probably take another 10 minutes, but overall, it will be completed within 20 minutes, right? And after blood donation, rest and eat fluids, drink fluids. Must, must, so that your body can make up for the lost fluid, so that there are no fluctuations in the blood pressure, right? So that is the reason why you're recommended to drink a juice or water 200 to 300 ml after blood donation to make up for the lost fluid in the body. Not lost blood, blood will recover in few weeks, but fluid is important to do that, right? Quite a few people ask me that is that so critical, right? Lost fluid. It is not. As I said, it's safe. And imagine drinking water, right? You drink water 1.5 to 2 liters a day, right? Which is part of the fluid in your body, right? Not blood, but it's a fluid in your body, right? And we go for urines and all, right? So that means that the content of fluid in your body keeps on changing throughout the day. You drink water, you go for urination, all those things, right? So changing the fluid level in your body is not a concern. It's not a concern, right? So don't worry that 300 ml fluid has reduced in your body, right? It's just that we want to reduce any fluctuations due to reduction in the fluid, because of which drinking fluid after donation is strongly recommended, right? But don't feel worried that something is lost from your body. No, it's normal. It's fine, that much fluctuation. Right? I've explained this. Request, ask if your couches are not clean, social distancing is not maintained, and you feel unsafe. Mention that, request that, right? I will hand over to Suman sir for the rest of the presentation. Suman sir.
Yes, thank you, Deepak, for the presentation. So I will continue about the blood donor safety post donation. The problem with donating, what people do is that people's perception about donating blood is that they think that they can become active within few minutes after donating blood. When some part of fluid is lost from your body, you need to listen to your body. I immediately see people coming out of the couch, standing and uh, clicking pictures in groups out of excitement and many other reasons. They don't even want to stay on the donating blood donation couch for few minutes. The reason is that when some amount of fluid is lost from your body, allow the remaining blood to circulate properly in your body. So rest for 5 to 10 minutes to ensure that the entire remaining blood is flowing uniformly throughout your body. Even though you are healthy, this is needed because we are taking the blood from the hand. The blood is extracted from a vein from the hand. It means that in the upper body, the amount of blood will be less, and so the entire flow should be balanced, and it takes some amount of time for that to happen. And immediately, as soon as you donate blood, start taking liquids as much as you can. And I suggest, if you are donating during summers, just before you donate blood, 10 to 15 minutes before you donate blood, have a lot of fluid, because when you will be sweating, sometimes you will be traveling and coming to the place where the blood is being donated. So I suggest, in case of summer, that extra precaution can help you. And the next thing is that plan for your diet in the next couple of hours. Sometimes what people do is that they donate blood and they don't want to eat anything outside due to many reasons. They think that they can go to their homes after 2 hours and have a happy meal or a healthy meal or a full meal. But unfortunately, by the time you reach to your house, when you don't have a meal, it may be creating some kind of issues for you. So ensure that you at least eat something. Don't stay empty stomach after donating blood for a longer period of time. I see it with many people who don't like to eat outside. They have their own reasons like safety or how the food is prepared outside and all. But something should be, at least eat a couple of fruits and then go back. That is what we suggest. And what few people do is that they remove the bandage that is kept on the vein, because sometimes they don't want to disclose to others that they have donated blood due to some reasons or many other reasons. They immediately take away the bandage. So sometimes what happens is that if the bandage is removed, then at the place where the needle is kept for a few minutes, it may show some effects. Or sometimes, if you don't put the hand properly after donating, they will ask you to put the hand in this fashion. Fold your hand and keep it like it for a few minutes, they will say. The doctor will put it. Don't keep your hand above the elbow and put it in this position. They will request you to do that. And I used to do that. I do it and I obey it. But what I observed was that they do it for formality, and as soon as the doctor goes, they remove it. And sometimes this disobedience, when they don't obey the instructions properly, it may create some other effect. So when the doctor or the instructor says to fold your hand after donating blood like this, keep it in this position and only remove it only when the doctor says. Sometimes what some medical professionals do is that they just put some cotton and they ask us to fold our hand like this, and they want that blood to clot slightly before applying the bandage. They cannot directly apply the bandage only when the blood is still flowing. So some time is needed. So this precaution is not being taken by many blood donors. What will happen is sometimes they see that again some blood is coming out of it. Some people may panic, oh my god, I'm losing blood. No, nothing will happen if you take proper precautions. The protocol is designed in such a way that the blood is extracted from this nerve by considering the fact that you can arrest the blood flow by just changing the position of your arm. We cannot dig deeper into the medical terminology, but all we can do is to follow the instructions given by the instructor and have patience, so that you can be in some other places. When I see, they remove the shoes, and after donating blood they immediately try to try to put on the laces, and they want to put it so tight so that the laces shouldn't come out. So in the due process, again they are straining their lower arm, which may create some inconvenience. So avoid that. Considering this issue, many blood banks, they ensure that they won't allow you to remove your shoes, or they give you some uh, foot covers while donating blood in some blood banks, and they frequently clean the blood donation area because you are coming inside with a shoe. So this either the hygienical practices are to be carried out, or this shoe cover things should be practiced. Can you go back to the previous slide once? I just have to. Yeah. And there are some of the other things are covered by Deepak Goyal about smoking and driving for the same reason, because it will create some inconvenience to the lower arm, and of course exercises. When you don't have enough fluids in your body, it's risky to do the exercises. Next slide, please. And I see many people, they complain that they got a bruise on their lower arm after donating blood. This bruising may occur because they might not have followed the instructions of folding their arm properly. This is one of the primary reasons why bruising may occur. Either they have not put it on the right time, or they have kept it, or they were moving their hand, or any other reason. And if you look at the number of cases where such bruises occurs, it's very, very negligible when compared to the number of people who donated blood. And even those bruises which you see, they are not harmful. Even if you apply some medicine, some ointment, they will be disappear. Those scars will disappear in a day or two, and it's not going to affect your health in any way. So don't worry about bruises. But a serious problem is about fainting. People, I saw people who faint. I asked the immediate thing when we ask a person uh, who fainted after donating blood was that, what did you had in your breakfast? He says that I had breakfast 4 hours ago, that too very little. So having when the instructor tells you about having proper breakfast, don't just say yes. It means that that guy is in some other mood. When the instructor asks, did you had heavy breakfast? It would be going over his head. He will only listen breakfast. He would not listen to the word heavy. So he should say, if you, according to his perspective, having 3 to 4 idlis or having 2 paratas, 3 paratas may be heavy, but while donating blood, sometimes having 1 paratha may not be enough, and that too after 4 hours before, or having 2 idlis 4 hours before may not be enough. So tell them, sir, I just had only give a bit more description. I just had this much amount of food, that to this much. This is the time interval. Now suggest. Then they will suggest have a proper meal and come. Sometimes it is not enough. And the second reason for fainting is that when you stay in the indoors, what will happen is that the carbon dioxide level will increase because we exhale carbon dioxide. When the ventilation is poor and when more people are there, the carbon dioxide concentrations will increase. And when the blood is taken out, this patient, or not patient, the donor needs more oxygen in a less amount of time. So when he is not able to get enough oxygen in the surrounding area due to improper ventilation, so he may get fainted because of the low circulation of oxygen. So we always ensure that when someone is donating blood, maintain distance from that person, allow the air to flow in the surrounding area of that person, so that he can feel comfortable. And even if someone faints, Do not panic. The only remedy is that, of course, this should be done under the medical supervision. Call the medical expert will always be there, and ensure that his legs are kept above the head. The head should be at a lower end and the legs should be at a higher end. What will happen? As I said before, in the upper body, when the fluids have lost, we are allowing the fluids to stabilize from the lower body to reach to the upper body and get that stabilization happen. That happens, and once the person comes to consciousness, he needs to take a lot of liquids and everything will be fine. Fainting is not just because of the fact that donating blood is harmful, it's because the donor did not follow certain instructions regarding to the food or regarding to the medication or any other things. Next, please. And as mentioned by Deepak Goyal, there are a lot of benefits of blood donation. Your blood will be completely screened. Not just because they want to know about your health, but they are concerned about the health of the patient to whom the blood is going to be transfused. In the due process, they check for all the ailments in your blood, and in case of any trouble, the hospitals will contact you. And the number of tests performed and the type of tests performed differ from hospital to hospital, and the availability of the blood reports also differ from hospital to hospital depending upon their own protocols. So you may get more information when in the corresponding blood banks, where you will be getting the information about it. Now I am going to tell about the hidden benefits of blood donation. Before we talk about what happens to what happens to our blood when we donate. Generally, the blood we donate will be either kept as whole blood, or it will be split into components: red blood cells, white blood cells, and platelets. They separate it and they use it for different medical purposes. Now, if I have 10 units of blood in my blood bank, how many units I have to keep it as whole blood and how many units I have to split it? It purely depends upon the demand, supply, and situations and the cases they get from the blood. They have their own protocols. Sometimes what happens is that when the number of units are not available, what they do is that they don't keep whole blood with them. They prefer to keep it in the form of, they split the blood into components by using some techniques, and they want to do it. Why? Because the lifetime of blood when it is split into components is more when compared to the life of whole blood. If you take whole blood from me and keep it as it is under some conditions, I have to use it within 3 weeks. But if I split the blood into components, I can store it for more amount of time, say for more weeks. Each component, say red blood cells will have some few weeks, and white blood cells can also be stored for few weeks. Plasma can be stored for few weeks. And when there is a scarcity, they may not be knowing how many units to store it. And I came across a situation where a newborn baby, she's 1 year old, and the parents needed that whole blood which was collected 2 days back with all the tests performed and kept in the blood bank. Due to scarcity, nobody is keeping the stock of that whole blood. They are keeping all the blood in the form of components, and in that night, when we received a call at somewhere around 10:30 or 11, their parents are hunting for the blood which is donated 2 days before and kept with all the tests performed. We were having donors ready, but we don't have that whole blood stored in stock. The entire night, our volunteers were contacting different blood banks requesting whether you have a unit or not. And due to some of the reasons, they said that you bring the sample to us, you bring the blood sample to us, we will match the sample and then only we will give. Due to some other reason, they are not verbally telling that whether the blood group is available or not. So throughout the night, our volunteers were approaching blood banks, their parents and relatives were approaching blood banks, and the doctor was telling that before morning the blood transfusion has to be done. And we were helplessly moving throughout the night, and thankfully at a distance of 40 kilometers away from the capital, in a blood bank, we found one blood unit which was stored in the whole blood form, and luckily we were able to provide that blood to the newborn baby. And for your information, that is B positive blood, where we think that it is easily available. If that is the situation of a blood bag which is more frequently available, what will be the situation? What could have been the situation if it is a negative blood? If 10 more people, when we ask a person to donate blood, he says that my blood is easily available, I am B positive, you will easily get it. No, my dear friend. Even B positive blood is not available in a certain form at a certain blood bank for a particular medical emergency. So, having a well-known blood group is not at all an excuse for not donating blood. So I kindly request all the participants and all the viewers to please go ahead and donate blood without even giving any excuses. That we know how we spent that night. Now let me continue with what happens to the blood we donate. Next slide, please. There are many purposes where this blood is stored in the blood banks. As I said, they will keep it in whole form to do some kind of surgeries and all. When they separate the plasma, they keep the plasma aside and they give only to the burns patient. If a person is injured in a fire accident, he will lose lot of plasma and they won't be injecting entire blood to him. They will only be giving plasma to him. And you can donate plasma once in a week. And this is what all the people should know. Donating blood is 3 months, but if you are donating blood components, the time interval is less. So, your blood will be screened, and after screening, it will be tested and the components will be separated, and they will be using those components for various purposes. Next slide, please. So before we tell us about what we are doing in our campaign, I would like, because I am a teacher and you all are students, I would like to give a small message, then I will hand it over to Deepak Goel related to blood donation. We all are blessed to write, blessed to study. We have got opportunities to study, every one of us. And not everybody is blessed to study and get these opportunities. Because one incident moved me a lot. A girl requested me for blood on a Friday. I'm telling you Friday, because there's something related to what happened on that Friday. So the exams were scheduled, students were busy, and I tried to find donors. I asked students, They said that, sir, we have exams and we cannot donate blood. Somebody gave the reasons and all. Okay. And this girl who requested blood started calling me frequently, in once in half an hour, and asking me whether I have got any blood donors or not. I politely told that students are having exams and they cannot donate blood at this stage. Then she told me, brother, uh, my elder brother is admitted over here, and if you provide me blood quickly, I can go back and I can write my exams. If the blood is not provided on time, I have to stay back with my brother in this hospital in Delhi. I cannot go back, and I cannot attend my exams. So please, if you help me in providing blood on time, I can go and appear for my 10th standard exam. And she was requesting. And I was helpless because I was not finding any more people, because she need 4 units for the blood transfusion for our brother for some surgery. And when I asked them, what will happen if I cannot provide blood? Is there any alternative? She happily said, this year I will protect my brother. I will think about my 10th standard exam next year. So here it's not just about blood donation. It's about the future of a girl, future of a woman who wanted to study and who is taking her responsibilities, who is keeping her responsibilities first instead of looking at her career. So we all are so blessed that we don't have any restrictions to write exams. We are all very blessed. Can't we give that opportunity to some other students to write exams, to come out of this pain? That too once in 3 months. I'm not asking to donate blood just before exams. You have an entire semester. Donate once in a semester or twice in a semester, few hours in a semester, and you don't know what difference it makes. If you think that, okay, no, somebody else will go, and unfortunately on that day none of us had gone because of many reasons. I have donated recently, students were not available, some went for vacation, some said that they are having exams. And when we try to contact that person after 3-4 days after exams and all, their phone is not reachable. Probably, I don't know what happened to that girl. So with this medium, I request all the students to kindly donate blood and try to uplift those people who are not blessed, who are as blessed like you. It doesn't take much time, and you don't know how your single unit of blood is going to make a difference. Not just not just to that patient, but to the society. I have just given 2 examples where how it can change someone else's life at a later stage. I hope we have enough reasons to donate blood now. Now I request Deepak Goyal to continue about what we are doing to ensure that this country is made blood sufficient.
Yeah, I think I will not take a lot of time, Suman sir. Thank you. I will probably take just 30 seconds and hand over to Gori. Right. Over my 18 years with the blood donation, right, I realized that all of us Indians are very empathetic. We love helping each other. It's not that we don't care for each other. We are not selfish, right? If at all, we do care for each other, but still we have a shortage of around 30% in India on voluntary blood donation. And I'm convinced that the reason for shortage of voluntary blood donation in India is just because of lack of awareness, nothing else. It's not because we don't want to help. It's not because we don't have enough eligible donors in India. We have 500 million plus. It's not because we don't care for others. We love each other. It's because we are not aware of it. We have myths like donor safety. We don't know where to donate blood. We don't know how to donate blood, and that's the biggest reason. And thinking, considering that in mind, Blood Connect launched mega awareness drive on this Republic Day to reach out to 10 million people like you and me, to make them aware of blood donation, to tell them what is blood donation, why you should donate, and it is safe, right? I humbly request all of you to participate in the awareness campaign. If all of us together will spread the message, only then we can aware people. So use the power of social media, use the power of youth, and spread awareness about blood donation by posting what you feel about blood donation, by tagging organizations working in the field of blood donation, including Blood Connect, and by sharing your photos when you donate blood. There is no there's no other powerful way of telling people that you believe in it than showing them that you yourself donated blood. People will believe it when they will see you donating blood, when they will see you talking about it. So talk about it, donate blood, and share with them. That's the most powerful way of creating awareness, right? And that's our vision of the campaign, to create awareness and make India blood sufficient. I will hand over to Gori for any quick questions in view of time. Gori.
Thank you, sir. That was truly insightful. I came to know about a lot of points that we must follow in order to ensure blood safety while blood transfusion. Um, there are a few questions that we have prepared for you. Uh, my first question is, statistics say that 32% of blood is discarded due to incompatible transfusions. What do you mean by incompatible blood transfusions?
Right. So I think, let me be clear that this 32% number is not really the overall blood number. It's 32% of the blood that is wasted because of incompatible transfusion, right? So let's not think that one out of every three unit get wasted. No. In India right now, the blood wastage stands somewhere around 4 to 6% of the total blood collected due to different reasons, and incompatible transfusion is one of the reasons for that. And it really is the scenario when the blood which is there for transfusion, which you take from a blood bank or from a donor, actually does not meet the patient blood group exactly. There are different things to match based on the requirement. Sometimes, in some certain circumstances, doctor will advise less match, right? And in some circumstances, they will advise complete match, which means all the properties of a patient must match to the blood transfusion, right? Now, and there are cases where that match is not possible, and then the blood that a patient has got from the blood bank or donated has to be discarded because of that mismatch test that happens on this. And that is why it is strongly advised that when you approach blood bank for taking a blood, if someone needs in your family or relative, be very specific what is the purpose and a doctor advice. Don't just hear that, okay, I need only A positive or O positive, right? And then don't assume that, okay, O negative is a universal donor, I can take that and, you know, transfuses. While it is, there are circumstances when doctor would always want to transfuse only your blood group, because you can take other blood group only few times during a lifetime. You cannot, even the universal donor, you cannot take that forever and number of times. So don't try to be a doctor yourself by reading on Google. Google has a lot of advantages, but it also a disadvantage that we discredit experts and we believe on Google too much, right? On this thing. So please do refer to experts.
Absolutely, sir. It's important to ask the doctor first before making any decisions by ourselves. Um,
Adding
next
to
question.
adding to what Deepak well said, the statistics are telling that it is wasted. But the question is, can we avoid this wastage? Is it avoidable, or is it due to some technical medical reasons? If it is unavoidable due to any kind of medical reasons, we can't help it. And there is sometimes back, I said that someone said that blood is wasted, some units of blood gets wasted and all. Just imagine, referring to the previous case I told you, I keep some whole blood in stock for a particular medical purpose for 3 weeks, so that in case of some unavoidable circumstances, I can use it. That case did not happen. Now I will, this lifetime of this blood is not, is completed now. Now I have to discard. So I am making that blood available, considering that some situation will arise. That situation is not arise. And how can I consider it as wastage? It is my preparation. So the perception of blood wastage is different from different from for different people. For a doctor, it is a emergency backup. For a blood bank person, it is an emergency backup. For a guy who sees from the outside perspective, he sees that, see, I gave blood, they are throwing it up. So we should understand what is actually the term wastage from different people's perspective. That's what I mean.
Absolutely, sir. Next question I would like to ask you is, in emergency situations, does screening of blood become a challenge?
It does, but very seldom it happens that fresh blood without screening will be given to any patient. Very seldom, right? It is strongly recommended, and most of the doctors will do that. The screening of tests that Suman sir mentioned, basic five tests, would always almost happen until and unless it is really about nothing else is available. You don't have screened blood available. It's a matter of minutes that if blood is not available, patient will anyway die, right? So, as I said, very seldom doctor will give unscreened blood to a patient, and before doing that they will always weigh benefits versus risk. Now, to avoid such situations, it is important that we have a adequate storage, or we have adequate stock of blood in our blood banks. One, because you can, so that we can manage emergency situations. Second, so that patient is not running from pillar to pillar to find a suitable blood unit. So that is why it is very, very important that our blood banks have adequate stock on this.
Adding to what Deepak Goyal said, there is one thing. There are some protocols given by the Defense Ministry and all. They say that if any, say, if 26th January event is going to happen, they instruct the blood banks that keep these many blood units in stock, in excess, because in case of any unfortunate situation or any attack or something like that, we need to have enough amount of blood. So, considering those kind of protocols and all, we cannot just say that the blood has been wasted as well. And there are many other reasons. For example, for an accident victim or for a heart stroke, for a different kind of ailments, we don't know which patient will come with which problem. So for all such kinds of things, they will be keeping blood in stock. And if excess stock is there, then they will start removing the old stock and ensuring that the blood is always there. Some amount of units are always kept in stock.
Yeah, and I think I will just mention Gauri, and I've seen that firsthand in some requests. When there's an emergency situation, doctor would strongly discourage first-time donors because their blood has never been screened, right? So in emergency situation, they would strongly prefer if to have a regular donors who have donated few times in the past to donate blood. As I said, if it's a real emergency where the time is of essence, you're in a remote area, nothing's available. So they would say that get a regular donor on this.
All right. Um, the next question that I have for you is, what are some of the challenges that India face in terms of blood safety, even with the national policies regulating the same? And are these policies enough?
I think, okay, so on policies, yes, policies are enough. We have, and I looked and read quite a bit of policies that we are framed by NACO, National AIDS Control Organization, and NBTC, National Blood Transfusion Councils, right? So we have international standard policies, to be honest, at par with developed countries in terms of voluntary blood donation. So policies are not a problem. Now it comes to the implementation of policies. So the standard of blood transfusion or a blood donation varied quite a bit in different parts of the country because health is a state subject, right? At some places, the policies are very strongly followed in terms of blood pressure, hemoglobin, temperature, team of doctors, storage, water, juice, food, everything is very strictly followed. At some places, it is loosely followed, and different excuses are provided: lack of infrastructure, lack of funds, XYZ, different excuses. All right. Now, my strong request is don't accept those excuses, challenge them, right? There are strong policies, national policies. Donor safety is critical, patient safety is critical. First, be aware of the policies, and if you think they're not being followed, challenge them, right? And ask for them. The other thing is that we have made a huge progress. Let's appreciate that in India on blood donation. We now have around 2,800 blood banks registered. Blood donation has increased from 4 million 10 years back to now 12 to 13 millions, right? So we are making a huge progress, but we're a country of 1.4 billion people. And it would take some time before we are blood sufficient, right, on this. The more we are aware, the more we are challenging it, the more governments will do come forward and start doing that. I would request people not to take blood by paying for it. Always recommend for voluntary blood donation. As per the policy, paid blood donation is banned, is illegal. But more than money, it is unsafe. Right now, now policies cannot help there. Policies are there. It is about individual. We need to understand. I might have money. I might have 10,000 to pay for the blood, right? I might not care about the money. But if I'm paying someone 10,000 rupees for a blood, do I expect that individual to speak truth to me? Do I expect that he or she will disclose that he or she is unwell or he or she had some disease? No, because he or she is getting paid, right? Because he or she is getting paid, there are very, very high chances that the person is unwell and the person is donating blood just under the influence of money, and you are getting unsafe blood. This is the only reason why paid blood donation is illegal, for the safety of patient. So be aware of that. Discourage paying for blood donation. Discourage it, right? And
Right.
that is how we can make blood safe. Policies are
Definitely.
there. Yes.
Definitely, sir. We should always keep that and keep that thing in mind. Safety is always the foremost thing to take care of. Um, that's it for the questions that I have for you. Uh, Thank you so much, sir, for answering all these questions. We had an insightful session. Now I would like to take up some questions from the audience. Um, Aryan is asking, how often can I give platelets?
So you can give platelets 24 times in a year, and you can give platelets after every 7 days, limited to 24 times in a year.
On next question. Do we have any more questions? All right. So the next question that we have is from Garvit. He's asking that is it true that donating blood regularly is healthy for the body as it urges the bone marrow to produce RBC at a higher rate?
Suman sir, you want to take it?
Well, Garvit, we are not taking a lot of blood. Firstly, the amount of blood we take is limited, and even if we don't take that blood out, the red blood cells die in once in 120 days. So the RBCs are the bone marrow is supposed to generate RBCs at a regular rate itself. So it won't be affecting much. But I can say one thing, that imagine if you have not donated blood. Say it's only among 300 ml of blood, and you have only 5 liters of blood. That fraction will not trigger this bone marrow to produce RBC at a higher rate. It won't be much stressful.
Yeah, I think in short, I will say donating blood regularly is healthy for the body, as I explained. Very, very healthy, proven scientifically. And it's not because of just bone marrow producing a higher RBC at a higher rate, right? There's a lot of other stuff around iron, blood pressure, cardiovascular health, because of which
I
we
can
are.
add. I can add about that. See, if more iron is present in the blood becomes more thicker, and your heart needs to put more pressure to pump that blood. If iron is in excess, so if that excess iron is removed in the process of blood donation, your heart need not. Your heart can pump it at a normal pace because the the blood won't be more thick with more iron present in it. So in a way, you are finding a mechanism to remove the excess iron that is getting accumulated in your body through various means. That's how it works.
Right. Okay, so Binayak is asking what kind of medication is a problem during donation?
Vinayak, as I said, there are a number of things. The key one is antibiotics. You should not be taking antibiotics at least 1 to 2 weeks before blood donation, because it can be dangerous for the patient, right? And as I said, there's a long list of things like dengue, malaria, typhoid, other things, which you should not be taking in different durations, 3 to 6 to 12 months on this. So and again, I will repeat, the list is long. Don't worry about knowing everything. If you're taking any medications, please consult staff on ground before donating blood, right? But the list of medication that you should not be taking before donating blood is pretty long.
Right. Ashay is asking how do whole blood donation and apheresis differ?
Uh, I will answer this question. In the whole blood, all your components are taken within 10 minutes. You are within the 300 ml of blood, all the white blood cells, everything is taken. But in the case of apheresis, you are only taking platelets. It means that the remaining components will be re-injected into your body. Why they do it is that because for some kind of medication you need platelets in more quantity. If I take whole blood, in that whole blood, the quantity of platelets will be less, which may not be sufficient for the patient, especially during dengue. When a person gets affected during dengue, you need more number of platelets. And if I take blood and if I separate platelets from that, I will get less amount. So that's why we use a term called single donor platelets, SGP, where the blood will be taken, platelets are extracted from the blood, and the remaining blood is again sent back to your body. So, and it takes a lot of time because your blood is going out, it is getting filtered, platelets are removed, and the remaining components are getting injected into your body. So, it takes a lot of time. So, probably 1.5 hour to 2 hours time for for an apheresis donation. Of course, subjected to conditions. Sometimes you need more number of platelet count. The platelet count in your body must be very high to donate apheresis because it will come down when you donate your platelets. So there are some differences while the blood is being screened.
Yeah, and I think
So
I will also ask very quickly. A lot of people ask that the blood is coming and going back to your body. Is it safe, right? On asphyresis, right? Let me tell you, it's completely safe. The same process is also used for plasma donation during COVID. The kit that is being used, the entire kit that is put in the machine that takes the blood, the bags, and that flows the blood back to your body is fully disposable, one time use kit. And it comes quite expensive. It costs around 3 to 5,000 rupees, right? So a good blood bank will have a fully disposable kit for this, and it is purely safe. And this is one of the reason why the STP cost is pretty high in the blood banks sometimes. So don't worry about the safety aspect of it. It takes time between 45 minutes to 1.5 hours, as Suman sir said, but completely safe.
Right. Um, Thank you for answering the question, sir. It is said that safe blood saves lives. Blood transfusion service is an essential component of healthcare, and access to safe and quality blood and blood products is its mandate. Millions of lives are saved through blood transfusions across the world. But without human donors, there can be no blood, and to date, there is no substitute available. So it is our responsibility to ensure that the supply of blood never runs dry, even in the face of inconvenience and adversity. It is our responsibility as the people of this community to donate blood. With this, we have come to the end of today's session. I hope you all have enjoyed the event as much as I have. But before we bid adieu, it gives me great pride and honor to propose the vote of thanks. I would like to thank Mr. Deepak Goyal and Dr. Suman Chintala for joining us today, taking time out of their very busy schedule. This session was truly enlightening for us, and I'm sure that we are all feeling very inspired. I would like to thank our faculty coordinators for constant guidance and support. Lastly, I would like to express my gratitude to our wonderful audience for joining us in today's session. Stay safe and have a good day.
Thank you, Gauri, and thank you everyone for joining this session. Thank you.